Today, we're going to start talking about the acquired heart defects or abnormalities that can happen. And again, overall, the acquired heart disease is something that all of you are probably much more familiar with. And I think in general, it's much easier to understand than all of these weird congenital defects. So hopefully things are a little bit easier to comprehend as we go forward. So here's a list of some of the acquired heart diseases that we're going to talk about today. Heartworm disease, of course, everybody's heard of that. Mitral insufficiency, tricuspid insufficiency, and then the cardiomyopathies. And we have dilatory cardiomyopathy, hypertrophic cardiomyopathy, and a kind of a weird one that's kind of in between these called restrictive cardiomyopathy. Then we're going to talk about a little bit of abnormalities associated with the heart muscle itself, and then some neoplastic things that can happen associated with the heart. So that's the agenda kind of for today. Heartworm disease, everybody's familiar with that. There's probably certain parts of the world and certain parts of the US, even in Canada, that this is not a very common condition. The rest of us, it's very common. Like we read a lot of radiographs for clinics in Las Vegas, and they don't have a problem with heartworm disease there because they're in the desert and they don't have mosquitoes because it's so dry and arid. But anywhere you have mosquitoes, you're going to have heartworm disease, and it can be a big problem in dogs. And you'll see some classic things with it as we go forward here. So heartworm disease, we know it's caused by Diarrhea immitis. It's transmitted by mosquitoes. You learned a lot about that during parasitology, and you'll see it probably the rest of your careers. The changes that you see in radiographs are not due to the adults. The changes you see are due to the reaction the body has and the allergic reactions to the heartworm disease and the microfilaria that causes changes associated with the pulmonary arteries and sometimes of the right side of the heart. So it has nothing really to do with the adult worms that live in the right side of the heart. It's all of the body's reaction and immune response to the heartworm disease itself. Typically, radiographically, what are you going to see with heartworm disease? We know that heartworms generally live in the right side of the heart. So they like to live in the right ventricle and especially the main pulmonary artery segment. And sometimes they'll actually live in the pulmonary arteries, the peripheral pulmonary arteries themselves. So because of that, you typically will see enlargement of the right side of the heart. You'll also see a bulge, usually of the main pulmonary artery segment. And that bulge is due to the presence of the heartworms themselves, as well as turbulent blood flow over time in the main pulmonary artery segment that will cause it to get big and kind of balloon out and dilate. And then the big thing that we see radiographically is we see abnormalities associated with the peripheral pulmonary arteries themselves. The pulmonary arteries become really big and dilated. They become blunted or pruned, and they become very tortuous. And so instead of nice tapering vessels that go out nicely and taper to the periphery of the lungs, these vessels become very curvy and wavy and very big and dilated. And then we can also see things in the lung itself. So very commonly, animals that have heartworm disease will get an allergic response in the lungs that you can see, and we'll talk more about that when we talk about lung patterns coming up, but they get changes in the lungs that will suggest an allergic response. So here's a lateral view of a radiograph of a dog that has heartworm disease. These changes are very mild. This dog's right side of the heart over here, remember that's the right atrial and right ventricle region of the right heart in this area. It's a little bit bulgy, it's a little bit prominent. The left atrium doesn't really look enlarged. But here, if you look, this little stripedy thing coming out right in here, that radiopaque thing, that's a pulmonary artery. And right underneath it is a pulmonary vein. And there's an air-filled bronchus between the two. And notice how this artery is wider in diameter than the pulmonary vein, and they should be about the same size. And so this dog has mild enlargement of the right heart, and it has mild dilatation of the pulmonary arteries compared to the pulmonary veins. It's very subtle in this particular case. However, if you look at the VD view, then it's not quite as subtle anymore. We still have enlargement of the right side of the heart, but what is this over here? See this great big rounded bulge over here? And again, on the VD view, we have to go back to that clock face analogy we talked about, and you have to know, well, there's something abnormal here. It's too big, but what lives there? And so if you think about it, what lives there is the main pulmonary artery segment, lives at about the 1 o'clock position on the VD view. This dog also has mildly dilated peripheral pulmonary vessels. It's the same dog we saw a while ago. And there's that craniolobar pulmonary artery right in here that's a little bit big. So I see several things, especially on the VD view on this dog that even has mild heartworm disease. I see right-sided cardiomegaly. I see enlarged prominent region of the main pulmonary artery. And I see on both views some of these dilated peripheral pulmonary arteries. And all of those together are very commonly seen with heartworm disease. If I go to this next dog, this dog is another dog that has heartworms, but his changes are a little bit more severe, a little bit more obvious. Again, enlargement of the right heart's more obvious than we saw on the other one. This craniolobar pulmonary arteries dilated. And if you look real closely and you kind of use your imagination a little bit, the lobar veins, the lobar arteries going out to this portion of the lung is really dilated. It's kind of tortuous, doing this kind of roller coaster thing. And then it comes back here, and all of this opacity right in here is a dilated pulmonary artery out in the periphery of the lung. And again, normally these vessels should be big here, but as they get out this far, they should taper and become smaller and smaller and smaller and smaller. And you can see right in here, this opacity is actually one of the pulmonary arteries, and it's as big or bigger than it is up here, and that shouldn't be. So also it looks like there's some busyness in the lungs, some interstitial stuff, and maybe a little bronchial changes in the lungs. But again, the first dog we looked at was more obvious on the VD view with heartworm disease. So let's look at this dog on the VD view. Do you see anything abnormal in this dog? So the heart looks completely bizarre. And again, he's got enlargement of the right side of the heart, but this huge thing here is enlargement of that main pulmonary artery segment. And again, if you look, this opacity coming in here, this weird thing coming out here that I can see right in here, that's a huge dilated pulmonary artery. So it's dilated, it's kind of tortuous, it's kind of winding around in here, and it comes down here and you can see it just kind of quits. It just prunes off. And so we have severe enlargement of the right heart, we have severe enlargement of the main pulmonary artery segment, and we have dilatation, pruning, and dilatation and tortuosity of the peripheral pulmonary arteries. That again is consistent with heartworm disease. This dog has moderate to severe changes. Here's another dog with heartworm disease. Right heart enlargement of this pulmonary artery here. And this one here, again, it's kind of tortuous and it's really dilated up in this area. This is a big pulmonary artery. It's kind of windy around and it's pruned off. This dog, if you look in his lungs too, you can see there's a bunch of little round things, little round holes in the lungs. And these are thick-walled end-on bronchi. And that's a sign of allergic lung disease that goes along with this heartworm disease. So they have a big allergic response from the heartworm disease. The changes in the pulmonary arteries are due to changes inside and outside of the pulmonary arteries, which is called a endarteritis. And that's the changes due to the allergic response of the intimal lining of the pulmonary arteries, where they become thick, and that increases blood flow and resistance through blood flow through those pulmonary arteries. And in response, they become really dilated and tortuous. And many of these dogs, if you echo them, you'll actually see the heartworms in the heart. And some of the dogs also, when you echo them, you'll see they have high blood pressure. So they'll also have concurrent pulmonary hypertension inside the lungs. Okay, so that dog has some significant changes. Here's the VD view. And again, same song and dance. Big right heart over here, enlargement of the main pulmonary artery segment. It's kind of bulgy up in this area. And again, this pulmonary artery coming out here is very dilated, it's pruned, it's tortuous, it doesn't taper like it should. Same thing, there's another one over here. That's kind of an end-on pulmonary artery. It comes out here and it's pretty dilated even down here. Heartworm disease in a cat is a little bit different. And we all know that cats do get heartworm disease. It's nowhere near as common as it is in a dog, but it's still pretty common in a cat, at least in this part of the world where I live in Houston, anywhere, and probably down there too, anywhere you have water and it's warm and you have mosquitoes. So typically in a cat, you don't see these prominent changes associated with the heart. The right heart really doesn't become enlarged like it does in a dog. You typically don't get this great big enlarged appearance of the pulmonary artery. In fact, in cats, you only get one or two very subtle changes that you can see on the radiographs. And a lot of these cats, their heart looks pretty normal, But the pulmonary arteries, again, are a little bit prominent in this region. Again, this is all part of a pulmonary artery coming out in here. And you can see it's kind of thready in here and kind of thin, but then it dilates. And then it comes back in here and it dilates again. And so the pulmonary artery is a little bit dilated. And if you look on the VD view, you can see here's the right caudal lobar pulmonary artery. And it's pretty darn prominent and it's pretty big coming out this way. Here's the left one coming out down here. Okay. So these are the caudal lobar pulmonary arteries that supply blood to the caudal dorsal lung fields. And they're big, they're a little bit tortuous. They kind of wind around a little bit and they're big. They don't really taper normally. So very prominent pulmonary arteries is one of the big things that you see in a cat. Again, you typically don't see the changes of the heart. You don't see a big bulge of the MPA segment. In a kitty cat, all you see typically is dilated, prominent, pruned pulmonary arteries. And some of these cats too, you'll also see changes in the lungs, like this little bronchus here, the little endon bronchus that goes along with secondary allergic lung disease from the heartworm disease. Okay, so heartworm disease, again, there's not much else that looks like it. The bottom line thing that you typically look for heartworm disease in a dog, you'll typically look for enlargement of the right side of the heart. You look for severe enlargement of the main pulmonary artery segment and dilated, tortuous, and pruned pulmonary arteries and diffuse mild bronchial infiltrates in the lung. In a cat, typically you don't see the heart changes, but you'll see still dilated peripheral pulmonary arteries and you might see the allergic changes in the lung. Okay, mitral tricuspid insufficiency. This is a very, very common problem that you'll see all the time in practice. This is a disease of small breed dogs. So any dog under probably 25, 30 pounds, very commonly as they get older, will develop mitral tricuspid insufficiency. The cause of this is endocardiosis. So endocardiosis is a disease that happens in older dogs, and again, small breed dogs for the most part always. It's not endocarditis. There's another condition called endocarditis, which is separate from this. It kind of sounds the same, but it's not. Endocarditis is a very serious condition you'll talk about more when you talk about echoes, but this is endocardiosis. This is a benign change where the valve leaflets normally in animals should be nice and paper thin and they move nicely. With animals that get endocardiosis, those valves become thick. They get this mucinous kind of thick mucus stuff that forms on the valves and it makes them sticky and it makes them to where they can't open and move like they normally should. And then the valves, because of that, they tend to leak. So instead of one-way passage of blood, they tend to leak blood back the wrong way when the heart contracts. And again, this is an older dog condition. It's degenerative. It gets worse. There's nothing you can do to actually get rid of the primary problem, the stuff that forms on the valve leaflets. All you do is try to slow the progress down and try to treat the animal for heart disease and heart failure as they get older. So endocardiosis causes mitral/tricuspid insufficiency. It's acquired valvular disease as these dogs get older. And for the most part, you show me a miniature poodle that's over 8 or 9 years of age, and most of those dogs are going to have some degree of valvular endocardiosis. So what do you see radiographically in dogs with chronic MITI? That's what the people Hilders talked about, mitral and tricuspid insufficiency. Because of these leaky valves on both sides of the heart, so that it involves the mitral valves and the tricuspid valves, they leak blood going the wrong way, which causes over time dilatation of the left atrium, dilatation and increased size and diameter of the left ventricle, and dilatation of all the chambers on the right side of the heart, so the right atrium and the right ventricle as well. It will also cause enlarged pulmonary veins, not arteries, but just the veins. And because the left atrium gets big, it will also cause typically dorsal deviation of the mainstem bronchus, which lives right dorsal to the left atrium. And anytime we see any of these mitral insufficiencies, acquired heart diseases, dilated cardiomyopathy, hypertrophic cardiomyopathy, we like to say in front of that diagnosis, is it compensated or is it non-compensated? So compensated mitral insufficiency would really mean that the dog has disease, but so far the dog is not in heart failure. He's compensating for the disease at this point physiologically, okay? A dog with non-compensated mitral insufficiency would be a dog that now shows evidence of heart failure. And in general, at least radiographically, we define it being in heart failure. Do you see evidence of pulmonary edema in the lungs or not? So dogs that have compensated mitral insufficiency have changes of their heart, but I don't see any evidence of pulmonary edema, at least so far. At some point, as that disease progresses over time, typically they will go from compensated to non-compensated disease, where now they are in heart failure and you see evidence of pulmonary edema. Okay, so let's look at some examples of this. So here is a lateral view of a dog, and we can see there's big enlargement of the right side of the heart. It's very prominent. Here's enlargement of the left atrium. We remember that lives right up here at the 1 o'clock position on the lateral view. So big enlargement of the right heart. The left atrium's enlarged. This part of the heart is the left ventricle. It may be a little bit enlarged too. And I don't see very well delineation. I don't see the margins of the left atrium aren't very well defined. So maybe a little bit of edema in his lungs. Typically it starts right up in that area. The pulmonary veins here and arteries coming out, they look pretty normal in this particular dog. On the VD view, again, the right side of the heart looks like it's enlarged. The part of the heart that lives right in here, what part of the heart lives right in there? Right in the middle of this bow-legged cowboy. Remember, that's where the left atrium lives on the VD view. So again, here's a trachea coming down. This is the bifurcation of the trachea going out to the right side of the lung. Here's the tracheal bifurcation going out to the left side of the lung. And the left atrium lives right in that little triangle right in there, and it's a little more opaque than it should be. So this dog has a mild bow-legged cowboy sign, if you will, that is due to left atrial enlargement causing summation in that area. If we go to this dog here, same thing, right heart enlargement, big enlargement of the left atrium. It's kind of squared off in this particular area. And here comes the trachea on the lateral view. It's nice and this wide until it gets down here to the mainstem bronchus, and that's super narrowed and dorsally elevated. So the mainstem bronchus live right dorsal to where the left atrium does. And so when the left atrium gets big, it's going to push up and compress the bronchi in that region. And then in that same area around in the caudal dorsal lung and this perihilar region, again, see how this part of the lung looks more opaque and it's, you know, in general, just busier than this part of the lung here. There's more stuff going on here, especially around that left atrium. And so this dog's starting to develop pulmonary edema. And also, if you look in his liver, and we haven't done abdominal yet, but if you look in the liver is also a little bit enlarged and the margins are rounded, which goes along with hepatomegaly. So this dog probably has some left atrial enlargement that's causing pulmonary edema. He's got right heart enlargement, and that's failing too, which causes the ascites in the big liver, the hepatomegaly. If you look here closely, this is the pulmonary vein right in here, and above it's the pulmonary artery. And now we have the vein that's larger than the pulmonary artery. So this dog is a non-compensated mitral/tricuspid insufficiency dog, most likely, okay? And again, the thing that you have to know when you look at this is you have to know what breed of dog it is. And again, the type of dog that gets compensated or non-compensated mitral valve disease, they're all going to be small breed dogs. So with dogs less than 20 or 25, 30 pounds. Here's a VD view. And again, big right heart enlargement right in here. Okay. And again, here's the trachea coming down. Normally the trachea goes off to the right side of midline in a normal dog, which this dog's doing. And then here's the part of the bronchus, the mainstem bronchus that's going over to feed the right lung. And here's the other bronchus, which you really can't see as well, coming over here to feed the left lung. But something, again, there's something more opaque living right between that bow-legged cowboy. And that summation of that area is where the left atrium lives. So big right heart, big left atrium, you can see on the VD view. And again, the pulmonary vessels are a little bit prominent. So this is a dog that has non-compensated, mild to moderately severe mitral insufficiency. And again, this is very, very, very common in small breed dogs as they get older. You can treat these dogs with drugs such as vetmedin and Lasix to get rid of the edema and things like that. But the cardiologist will advise you better on how to treat these dogs. Okay, dilated cardiomyopathy is another acquired heart disease that happens in dogs. And dilated cardiomyopathy now is a disease of big dogs, so large breed dogs. It's really weird, and I'm not sure why it happens, but dilated cardiomyopathy is a disease of large and giant breed dogs. And again, the mitral insufficiency is almost exclusively a disease of small breed dogs. Radiographically, they look identical. Okay, so all of those images I showed you previously, like this one, if this is a small breed dog, if this is a poodle or a cocker spaniel or a King Charles Cavalier, your diagnosis is going to be non-compensated mitral / tricuspid insufficiency. Okay, if this was a Doberman, your diagnosis changes. It's going to be dilated cardiomyopathy. So in general, if you get, and it used to be easy back when we had analog films, right? And we would hold them in our hand, then you can tell if it fit on an 8x10 film, the dog's got mitral insufficiency. If it fit on a 14x17 film, that's bigger because it's a big dog, the dog's got dilated cardiomyopathy. Okay. So they look basically identical. So again, dilated cardiomyopathy is a disease of large breed dogs, and there are certain breeds that really get it all the time. That's very common. And the big ones are going to be Dobermans, Boxers, and Great Danes really commonly get dilated cardiomyopathy. Dilated cardiomyopathy is a systolic dysfunction of the animal. So it's where the heart muscle itself it loses the ability to contract well. And so we lose this force of contraction, and it doesn't pump enough blood out to supply oxygenated blood to the body. It used to be years ago, it was associated with a vitamin or a amino acid deficiency in cats, taurine, but they stuck that in all the cat diets now, and so you hardly ever see that anymore. So you hardly ever see dilated cardiomyopathy in a cat. And again, when we see dilated cardiomyopathy, we try to describe it, is it compensated or non-compensated? So what does dilated cardiomyopathy look like on radiographs? You'll know this is basically exactly the same thing that we did for mitral insufficiency. Enlargement of the left atrium, the left ventricle, the right side of the heart, the pulmonary veins get big, and you can get dorsal deviation of the mainstem bronchus, and you may or may not see signs of heart failure. So here's a lateral view of a dog with dilated cardiomyopathy. Right side of the heart's big, left atrium's big, and you get all this fluffiness or this interstitial stuff that's forming in the lungs around the heart and around the left atrium. Okay, so that would be another dog that has non-compensated dilated cardiomyopathy. And how do we know this dilated cardiomyopathy most likely is because it's a big dog. Same thing on the VD view. Some kind of a big left atrium between the bronchi, right side of the heart's big, and all of this busyness, this interstitial stuff, this patchy, fluffy stuff in the lungs is due to pulmonary edema. So again, radiographic appearance of dilated cardiomyopathy and MITI, it's the same. The radiographs basically are going to look the same, except one is a disease of small breed dogs, mitral insufficiency, tricuspid insufficiency, or valvular endocardiosis. And dilated cardiomyopathy is a disease of large breed dogs. So when you get out clinically and you're, Joe Blow vet in your clinic, and you have an older dog that comes in and he's coughing and he has shortness of breath and exercise intolerance and he's got a murmur and his lungs sound kind of wet and crackly. Basically, if it takes you one arm to pick that dog up and put him on your exam table to listen to him, he's going to have mitral insufficiency from valvular endocardiosis. If it takes two arms, because he's a big dog, to pick him up and put him on the table, he's probably going to have dilated cardiomyopathy. That's another way that you can kind of tell the difference. It's just, again, it's so specific. Valvular endocardiosis and mitral insufficiency is a disease of small breed dogs, and dilated cardiomyopathy is a disease of large breed dogs. But radiographically, they look pretty much the same. Okay, Chagas disease. Did y'all learn about Chagas disease when you took parasitology? You probably remember a little bit. It's caused by a protozoa, Trypanosoma cruzi, and this is only common in certain parts of the world. We do see it here in southern Louisiana and South Texas. It's caused by the intermediate host is this Reduvidae beetle, and it results typically in myocarditis. So it's causes an infection of the heart muscle itself. And the end result of that infection in the heart muscle is that it loses its ability to contract very well. So radiographically, these dogs behave exactly the same as a dog with dilated cardiomyopathy. The heart can't contract like it used to, but in this particular case, it's due to an infection of the heart muscle or myocarditis due to Chagas disease. Again, radiographically, it's going to look the same as a dog with dilated cardiomyopathy, except this dog came from South Texas, it came from Louisiana, and you'll see this in other parts of the world too. Any place that has a predilection for this Trypanosoma cruzi. So here's a dog, a big heart. Left atrium's not big in this particular case, but great big right heart. Really don't see much in the lungs. Again, just a big right heart. And it just so happens this dog, you can echo them and you'll see typical changes with dilated cardiomyopathy. Contractility won't be very good. But again, you have to look at the history of where this dog is from. He may not respond to typical medical management. And so they tested him for Chagas disease, and sure enough, he was positive. Okay, now we're going to switch over and talk about hypertrophic cardiomyopathy. And hypertrophic cardiomyopathy is a cat disease almost exclusively. So it's kind of weird. You can classify some of these acquired heart diseases into species and into what breed it is. And so cats get hypertrophic cardiomyopathy really, really commonly as they get older. Okay, but cats will never get, and you never say never, but for the most part, cats never get dilated cardiomyopathy. On the other hand, large breed dogs get dilated cardiomyopathy all the time, but they will never get hypertrophic cardiomyopathy. Okay, mitral insufficiency is a disease of dogs, but only small breed dogs. Cats don't get that either. So that you kind of have to keep these a little bit separate depending on what kind of animal and what breed you're looking at. So hypertrophic cardiomyopathy, again, it's a cat disease. There's two basic kinds of hypertrophic cardiomyopathy. The primary hypertrophic cardiomyopathy is there's a problem with the heart itself. The heart muscle itself has got a problem. Secondary hypercardiomyopathy is due to a condition that's really common in older cats called hyperthyroidism. And one of the results of hyperthyroidism is the increased thyroid levels circulating in the blood contribute to causing the heart to contract harder and faster. And over time, then the heart is a muscle. And if you work it all the time and faster, it tends to dilate and become thicker in the wall thickness, which results in cardiomyopathy. Okay. So hypertrophic cardiomyopathy is a diastolic dysfunction. So basically the heart muscle in these cats that have hypertrophic cardiomyopathy, and in general, it's going to be the left ventricular free wall and the interventricular septum. So all of the musculature that surrounds the left ventricular lumen becomes really thick. And it becomes so thick towards the outside and the inside where the lumen is of the left ventricle, there's hardly any blood inside, hardly any volume inside the left ventricle to hold any blood. It becomes almost slit-like. Instead of a ball that's ready to accept blood inside the left ventricle, it's a little slit of a potential space that contains and can only hold a small amount of blood. And that's due to the thickening of the musculature around the left ventricle. Okay. So the heart has no problem contracting. In fact, there's too much muscle. It can contract really well, but it can't fill. There's nothing to push out because now the lumen it contains very little blood. So what do you see with a cat with hypertrophic cardiomyopathy is we see dilatation of the left atrium. The left ventricle becomes enlarged and the right atrium becomes enlarged. The big things in these cats that have hypertrophic cardiomyopathy is the atria. So both atria can become severely dilated. And why would that be? Well, if you have systemic blood that's coming back into the right side of the heart, the right ventricular lumen also is narrowed in diameter. And so blood can't go from the atrium into the ventricle. So it tends to collect in the right atrium and sit there. Same on the left side of the heart. As blood tries to come back from the lungs into the left side of the heart, in the left atrium, the blood can't drain from the left atrium down into the left ventricle. And so it has nowhere to go. So it's like plumbing. It backs up and sits in the left atrium. And so you end up with this biatrial enlargement of the heart. And people will describe the radiographic appearance of these cats that have hypertrophic cardiomyopathy as being somewhat Valentine shaped. And so you get the classic Valentine shape appearance of the heart, especially on the VD view. And as these cats' condition gets worse and worse and worse, they'll develop pulmonary edema, which is usually due to left heart failure, and they might get some pleural effusion, which is usually due to right heart failure. So if I look at this lateral view of this cat with hypertrophic cardiomyopathy, you can see this part of the atrium, the part of the heart right up in here is where the atria live. And it's really big and kind of rounded and prominent. And again, we see this here in this area right in here is the left atrium. We see this concavity on the caudal aspect of the heart. So it's kind of got this divot on the caudal aspect of the heart on the lateral view due to the enlarged atria. So both the right and the left atria are enlarged. Remember when we talked about discrete chamber enlargement, we said that in dogs, they get huge dilatation of the left atrium up in here, but that so much doesn't happen in cats. We don't really see that in cat. We might be seeing a little bit of it in this cat because it's so severe. But typically they won't get this huge dilatation like we see in dogs. It usually stays underneath the level of the trachea and the pulmonary arteries. So we get this bulge right in here. We get this bulge over in here, which is considered the biatrial enlargement. On the VD view, you can see here's the biatrial enlargement, right atrium here, left atrium here. And it starts to take on this Valentine-like appearance. And these cats, again, will have a significant murmur, a systolic-like murmur. So it's pss, pss, pss type murmur as you listen to it. Again, really common in cats. This cat here, you can't see the edges of his heart or the margins of his heart really well because this cat is going into heart failure. So now this cat is going from a compensated hypertrophic cardiomyopathy. This cat is now decompensated. So you can see all of this fluffy stuff, which is interstitial and stuff that's forming in the lungs around the heart. And now because of this stuff in the lungs, we can't see the edges of the heart like we could here. Here are the edges of the heart or the margins of the heart are pretty well defined. The lungs look pretty happy. Over here, we can't really see the margins of the heart because now we have all this pulmonary edema that's starting to form in the lungs due to underlying cardiac disease. Again, we start to see this severe biatrial enlargement, right atrium, left atrium over here, kind of not much of a Valentine appearance, maybe a big fat Valentine appearance, but it still looks very abnormal with biatrial enlargement. And again, we have all of this fluffy stuff that's forming around the lung, around the heart. Restrictive cardiomyopathy is kind of a weird one. It's not really dilated cardiomyopathy, and it's not really hypertrophic cardiomyopathy. It's kind of half and half. And restrictive cardiomyopathy, as far as I know, is for the most part only seen in cats. Okay, and is typically common in the large breed cats, like the Maine Coons and the Ragdolls. And in this particular case, the heart muscle isn't thick like it would be if you had a cat with hypertrophic cardiomyopathy, and it's not thinned, but it still doesn't contract very well. So it's not hypertrophic cardiomyopathy. It's a little bit more like dilated cardiomyopathy. However, the heart is not dilated. So it's a thickening. It's where the heart muscle just kind of loses its ability to contract, but the heart's really not dilated secondary to it. And so restrictive cardiomyopathy is the other name for it is intermediate cardiomyopathy because it's kind of intermediate between a dilated and a hypertrophic cardiomyopathy. Okay. And again, you'll only see this in large breed cats for the most part. They come in with signs of heart failure. They might start showing pulmonary edema. Typically, radiographically, their heart looks completely normal. And the only way to diagnose these is you do an echocardiogram. And with the echocardiogram is the ultrasound that you can see inside the heart. And you can actually measure the contractility of the heart and see how well it's contracting. And these cats will have decreased contractility. Okay, again, with cats with restrictive cardiomyopathy, most of the time the radiographs are normal. However, as the disease gets worse, they'll start to show signs of heart failure. So they might start to seeing a little bit of pericardial effusion or pulmonary edema or pleural effusion. Okay, so we kind of covered acquired valvular disease or the mitral insufficiency. The mitral insufficiency, is that a disease of small breed dogs, large breed dogs, or cats, or giraffes? If I asked you that, on a test, how many of you would pick giraffes? Okay, hopefully not many. How many would pick small breed dogs? I would think that would probably be the answer. What is the etiology of dogs that have mitral insufficiency? Okay, what causes it? That's what that means. So what causes it is they have valvular endocardiosis, not endocarditis, but valvular endocardiosis, which causes the valves not to be able to move right, and they become leaky, which leads to all these problems. Okay, if you have a animal that has dilated cardiomyopathy, is that a disease of small breed dogs, large breed dogs, cats, or giraffes? Okay, dilated cardiomyopathy is a disease of large breed dogs. It's where the heart muscle loses its ability to contract very well. And so the heart becomes big. It can't push the blood out of the heart because the heart muscle is weak. And you end up getting conditions such as heart failure or pulmonary edema and pleural effusion and ascites and a big liver as the disease gets worse. Okay. If you have an animal that has hypertrophic cardiomyopathy, is that going to be a disease of small breed dogs, large breed dogs, cats, or giraffes? Cats. It's going to be kitty cats that get that. Hardly ever will you ever see a dog that has HCM or hypertrophic cardiomyopathy. These cats are almost always older. They come in, they have exercise intolerance, signs of heart failure. You'll radiograph them, they have a really fast heart rate, and you'll radiograph them, they'll have a Valentine biatrial enlargement. You can echocardiogram, and their heart muscle, especially around the left ventricle and the interventricular septum, are super thick. Okay. And so that is typical hypertrophic cardiomyopathy in a cat. Okay. What if you have a dog that comes in and he's coughing and he's kind of got a big heart and he's got a murmur and he's got exercise intolerance, and you talk to the owner and they're from South Texas in some kind of, and the reason why it's common in South Texas is the closer you get to Mexico, it starts to become more and more common. Okay. And so if you get in some of these other countries that have more problems with parasitic disease, and Mexico is one of them, then you want to consider, well, maybe he doesn't just have dilated cardiomyopathy. Maybe the cause of that is actually he could have a parasitic disease like Chagas disease. Okay. So you kind of get the idea. That's kind of how you have to think about all of these diseases going forward. And again, all of these acquired heart diseases, you would like to describe radiographically, is it compensated or non-compensated? And if it's compensated, that means you don't see radiographic evidence of pulmonary edema in the lungs. If he's non-compensated, then you do see evidence of heart failure or evidence of pulmonary edema in the lungs. Okay, now we're going to move on to more acquired heart disease. We're going to talk a little bit about cardiac neoplasia. There's several of them that can happen, but only one or two that happen commonly, and those are the ones we're going to spend time on. So again, overall, cardiac neoplasia is pretty rare, but it happens for the most part in animals that are older, just like most neoplasias, right? You can get tumors that occur on the outside of the heart, on the pericardial surface. Okay, and the most common one here is going to be one called mesothelioma. Pretty rare, but it can happen. You can get tumors that occur actually in the heart muscle, and these are going to be hemangiosarcomas and lymphoma or lymphosarcoma. And then you can get tumors that occur inside the chambers of the heart or next to the heart. Okay, and hemangiosarcomas, usually almost always in the right atrium. There's another weird one called a myxoma, and there's another one called a chemodectoma that we'll talk about too. When you get tumors of the heart, especially in older animals, they tend to cause pericardial disease. And what happens is you have a tumor, let's say you have a tumor that's living in the right atrium or up in the heart base or associated with the pericardial sac. And that the body's response to that is it's irritating, the tumor is, and a lot of times the body then will make fluid and develop fluid in the pericardial sac around the heart, okay? And so this pericardial sac, again, is around the heart. It's made out of fibrous tissue. It doesn't like to stretch, okay? And so you start getting more and more fluid inside the pericardial space. Over time, then it will put pressure back on the heart, leading to heart failure. So the great majority of these cardiac tumors will generate amounts of pericardial fluid, which then will put pressure back on the right side of the heart, which leads to heart failure. Okay. So what is pericardial effusion? How much pericardial fluid should a normal animal have inside the pericardial space? And we talked about that earlier. We said the normal amount is a few drops. Typically, you have just a little bit of fluid inside the pericardial sac, outside of the heart, that keeps everything gliding nicely and keeps things from rubbing against each other. So just a little bit in there for lubrication. You'll hear some words that go along with pericardial fluid, and one of them is called tamponade. So if you have an animal that has pericardial tamponade, that means the tamponade word means that there's so much fluid inside the pericardial space, it's pushing back on the heart and compressing the heart and causing heart failure. Now, if I asked you what side of the heart, left heart versus right heart, what side has the thinnest wall and what side has the thickest wall?
Right has the thinnest.
Yeah, right has the thinnest. So it would make sense that if you start getting this fluid that forms around the heart and it's pushing back on the heart, is it typically going to affect the part that has the thinnest wall or the thickest wall? It's going to affect the part with the thinnest wall. It's easier to push around because it's thin. And so most of these dogs that start to develop pericardial tamponade due to pericardial fluid will push and compress the right side of the heart first. So these dogs typically end up with right heart failure. Okay. Again, pericardial fluid is a diastolic problem. As the pericardial fluid pushes on the right side of the heart, then there's no lumen inside the right ventricle to fill. And so it really can't fill because it's being squished from the outside, the lumen is. Okay. Pericardial effusion can be different kinds. Most of the time that you're going to see it in small animals as they get older, it's going to be associated with some type of neoplasia. So in general, and I tell my residents this all the time, if you have a dog that's middle-aged to older and he comes in and he has pericardial fluid, then it's a tumor hunt. There's going to be a tumor in there somewhere. You just got to go find it. And typically the way to do that is with an echocardiogram. So you ultrasound the heart. So much more common than any other ones is neoplastic effusions in older dogs. Every now and then you'll have a dog that has an inflammatory or non-inflammatory or traumatic effusion. So dogs can get an infection inside the pericardial space from a penetrating wound or something like that. Of course, in cows, they get this problem. We don't worry about cows so much except it's getting to be lunchtime. So, but other than that, right now, we don't worry about inflammatory hardware disease in small animals. It just pretty much happens in cows, right? Okay, so what do you see with pericardial effusion? Mild effusion, the heart will probably look very normal on radiographs. But once they start to get the moderate to severe effusion, and we have all this fluid that's forming within the pericardial sac, but around the heart. And so now we have all this fluid that forms around the heart. And so the heart starts to become very rounded in appearance, no matter if you look at it on the VD view or on the lateral view. So you look for a perfectly round, big, giant, almost volleyball looking, basketball looking heart. Okay. So if I showed you this radiograph, would you say this heart looks like it's normal in size or probably too big or too little? How many's going to say probably too big? Okay.
Big.
It looks huge. It's not just big, it's freaking huge. And so if I look at this view here, again, does that heart look big, too little, or just right? It's too big. It's huge. It looks like a big beach ball in there. So it's taken up the great majority of his thorax. And do you see any evidence of chamber delineation? I don't see delineation of the left atrium. I don't see delineation of the right atrium. The whole thing looks big and round. And that's because we have all this fluid around the heart in the pericardial space. And again, if this is an older dog, the first thing I'm going to want to do is put an ultrasound probe on the heart, confirm he's got pericardial effusion. If he does have pericardial effusion, then the second thing I'm going to do is I'm going to start looking for a tumor. There's going to be a tumor in there somewhere. You can pretty much bet on it. Okay. Again, here's another dog with severe enlargement of the heart. Huge, huge, huge. Okay. If you tell me that heart looks normal, then you might as well just drop out right now. Okay, again, non-neoplastic pericardial effusion. We're not going to spend any really time on this. All I want you to know there is that it can be not due to a tumor, but it's really rare. Anytime you see pericardial fluid and a big rounded heart like that, especially in a middle-aged to older dog, you start thinking it's got to be a tumor. I just got to find it. Okay, again, the neoplastic, the common tumors that are going to cause this, probably the biggest one that you're going to see most commonly is this first one on the list, hemangiosarcomas. And hemangiosarcomas is a aggressive tumor. It's a blood-borne tumor, okay? And it always lives only in one part of the heart. Isn't that weird? Why? I have no idea, okay? I have all these noble questions that I want to ask, you know, when I get up to heaven, which probably is never going to happen. But when I get up there, I want to, first thing I'm going to do is I'm going to say, hi, God. And then I'm going to say, thanks for letting me in. I didn't really have my doubts. And the third thing I'm going to say is, you know, I have this list of questions I want to ask you. And these are called noble questions, right? And one of them is going to be, you know, how come hemangiosarcomas only live in the right atrium? How come they don't like to live anywhere else inside the heart? And I'm going to expect an answer, right? And so hemangiosarcomas only live in the right atrium. Why? I don't know. It's a noble question, okay? But I know that hemangiosarcomas that live in the right atrium over time will almost always cause pericardial effusion, okay? And then you get this big basketball looking sized heart, but then you have to go in and you have to think, okay, there's two kinds of tumors that are really, really common that's going to cause pericardial effusion. And the biggest one is hemangiosarcoma. The other one is going to be this one here, a heart-based tumor, which is called a chemodectoma. There's other ones that can happen like a weird thyroid carcinoma, but chemodectoma by far is the most common one. And this tumor here lives outside of the heart, but inside the pericardium. So it lives in the pericardial space near the heart base. So kind of right where the aorta comes out of the heart. And this, you can find this one, it'll look like a big oval shaped or round solid mass that you can find with ultrasound right near the heart base. This one is a big irregularly shaped mixed echogenic solid mass that lives inside the right atrium. Both of those, the chemodectomas or heart-based mass and the hemangiosarcs, will cause pericardial effusion. And again, there's other weird tumors that can do the same thing, but those are the two big ones that you should know about. Okay. Another weird thing that you'll see every now and then is called a spontaneous pneumopericardiograph. Now that's a party word, okay? So you got to remember words like this. Like if you're at a bar and you're having a couple of beers or something like that, and there's people around you and you want to impress them, then you just strike up a conversation about spontaneous pneumopericardiogram, okay? Because it just makes you sound like you're smart. Okay, so the spontaneous pneumocardiograms is rarely seen, but sometimes you'll see it in dogs that have been hit by a car right after they've been hit by a car, or any kind of blunt trauma, like they've been kicked or something like that. And spontaneous pneumocardiograms is actually the presence of air, free air, within the pericardial space. And usually it's nitrogen that actually comes from the pericardial space, or blood that actually dissolves out and pulls out of the blood and forms a little bit of air in the pericardial space, most of the time due to trauma, to blunt trauma. So here's a heart, and you can see there's a little bit of air surrounding the apex of the heart right down in here that's in the pericardial space. It usually doesn't mean anything, except the dog may have had trauma. It will go away usually within a few minutes, but sometimes you'll see air that forms in the pericardial space. Spontaneous pneumopericardiograph. And again, if you see it, it goes away, so don't worry about it. Okay, we have to take a break, and so we're going to quit at this point and come back here in just a few minutes and continue on.